Now let's start with the section 4 of our lecture, and in this section, which is the fourth section, we will talk about some immune disorders and drug allergies that can lead to the formation of ulcers in the oral cavity or different disorders of the oral cavity. So commonly we will talk about the aphthous ulcer and then Bassett's syndrome. Also, some drugs that can lead to the formation of ulcers or trauma to the oral cavity and disorders of the oral cavity. And besides these three conditions, Bassett's syndrome and then aphthous ulcers and drugs causing the disorders of the oral cavity, we will talk about some miscellaneous condition in which the oral cavity is involved. So immune disorders are the which can cause aphthous ulcer, which is the involved movable and sparing mucosa. So aphthous ulcer mainly involve the mucosa, which is movable type of mucosa and sparing mucosa. Minor form, usually we have minor multiple red hollow lesions or ulcer, and they are multiple ulcers. In the major form, there are bigger ulcers, heals with scar. So big ulcers are in the major form of the aphthous ulcer, and small ulcers, multiple red hollow ulcers in the minor form of the aphthous disease, and it mainly involves the movable type of the mucosa, and it's an immune disorder. Autoimmune process, there is also in nutritional deficiency, especially vitamin B12 deficiency and iron deficiency lead to these ulcers. Viral or bacterial infections, food allergies, and if there are hormonal changes or stress, all these conditions can lead to the aphthous ulcer. So we said that it involved mainly the movable type of mucosa. We have two forms, minor form and the major form. Minor form, usually the ulcers are multiple and they have red hollow, and then in the major form their ulcers are big, and these big ulcers, when they heal, they leave the scar behind. Some common causes: autoimmune disorder or process, nutritional deficiencies, especially patients who have deficiency of iron and vitamin B12. Females are very common have iron deficiencies, anemia. So that iron deficiency can lead to the aphthous ulcer formation. Viral and bacterial infection is another cause, and then different foods, people who are allergic to some foods, some are allergic to dairy products, some are allergic to other foods. These people, meat allergies, beef allergies are also very common, and these ulcers are formed as a result of these allergies. Then hormonal changes or stress can cause aphthous ulcer also. Another is the Bassett's syndrome, which is another immune disorder due to immune deficiency. The edges of these ulcer, Bassett's syndrome, here if you see, this is the ulcer. The edges are punched out. They are punched out, and this is the ulcer, which is like a deep ulcer with the edges are punched out. Lesions, it involves the skin, joints, and central nervous system. Clinical features of the Bassett's syndrome, we have aphthous-like ulcer. We already talked about the presentation or prescription of how present the aphthous ulcer present. So this is the same as the aphthous ulcer, but if you see, the edges are the punched out, otherwise they are same, both are the ulcers are same. Then we have genital ulceration also present in Basset syndrome. Uveitis, eyes are involved. Uveitis is present in Basset syndrome. So these are some differentiating features. Ulcers are more or less the same in the Basset syndrome and the aphthous ulcer, but it involves the eyes, it involves the genital system, which leads to genital ulceration, and also affects the joints and the central nervous system. Some drug allergies like cause erosive, vesicular or bullous lesion. All these different types of lesions are formed as a result of drug allergy. It is erosive, vesicular or bullous lesion. Contact stomatitis may occur. Oral lesions are present, and reaction to lozenges, gum, toothpaste, etc. Especially toothpaste, if you ever notice, there are some toothpaste that can cause the allergy and cause the ulcers and lesions in the oral cavity. So we need to change the toothpaste also. And some drugs that have this effect, the important treatment for that is to get rid of the drugs that are causing this reaction. So make sure, pay attention what drugs are causing this effect, and then you need to switch the medicine or the drug causing the disorders of the oral cavity. Vitamin B12 and folic acid deficiency also lead to the ulcers. So folic acid, iron and vitamin B12, all these can cause the oral ulcer. So constant recurrent ulcers, if they are present, it's important we should check the level of vitamin B12 and iron, and supplemental therapy is helpful to get rid of these ulcers. Miscellaneous conditions that can cause disorders: radiation mucositis. People who are getting radiation, they can get inflammation of the mucosa and develop the lesions. Follow radiation of the oral cavity. Spotty area of mucositis are present. Slough covered ulceration. You can see these are slough colored ulceration, and there is spots on the mucosa. Can be due to drug like methotrexate. Methotrexate is the drug used for different cancers, even condition psoriasis. Very commonly people use methotrexate, and these are usually they present with the oral ulcers or disorders of the oral cavity. Clinical features is erythema, redness, and ulceration and edema. Ulcers are formed, there is redness and the swelling as a result of radiation therapy of the oral cavity. So this was all about section 4. Thank you for watching sqadia.com.